Record. Hello, everyone. Welcome to our February All-Com webinar for Oregon's 1115 Medicaid waiver. We're so excited that you were able to join us today, and we have a lot of great stuff to share. Going to quickly skip over the Zoom meeting tips because for the folks in the room, we talked about this already, and if you're here for the recording, the Zoom meeting tips aren't that useful. Today, we're going to focus on three major things. And I would say a lot of these are continuations of things that we have shared in past sessions, but we're going to be giving a really brief overview of the 1115 waiver, what it is doing right now, its background, and our goals. Make sure we're all on the same page. We are going to talk in more detail about the climate-related services that are going live extremely soon at the beginning of March. And then we are going to share more information about the community capacity building funds, which is a funding opportunity that will also open very soon. I didn't say who I was. Hello, I'm Jessica Diaz. I work for the Oregon Health Authority. I use she, her pronouns. And I'm going to take this opportunity to stop talking and to hand it over to Steph.
Thank you, Jessica. Good morning, everyone. My name is Steph Jerem. I use she, her pronouns. I am the OHA 1115 Medicaid Waiver Policy Director, and I'm really happy to see all of you today. Really great timing because, as Jessica said, our first benefit is going live very soon. And so we're going to take this opportunity to go into detail about what that really means today. To start, we're going to go through, just in case there are always folks that may be joining for the first time or just benefit from, hearing things multiple times. We're going to go through the background of the waiver briefly before we get into the rest of our topics. So to begin, our goals around the waiver, we always like to state, are really first and foremost to address and advance health equity. It's what shaped all of our decision-making around our work. We will be doing this by creating a more equitable, culturally and linguistically responsive healthcare system, ensuring people can maintain their healthcare coverage through our Medicaid expansion, improving health outcomes by addressing our health-related social needs and ensuring smart and flexible spending around that. And as a reminder, we always like to note that our Healthier Oregon OHP members are also included in these benefits. We have some really great up-to-the-minute accomplishments that we're proud of. On February 1st, so just a few weeks ago, we received our final CMS, that's the Centers for Medicare and Medicaid Services. They are federal overseers in this space, and so they gave us approval of the Health-Related Social Needs Services Protocol. The services protocol is how the work is actually going to be done in the state. So this gives the detail about eligibility and really all of the nuts and bolts of the benefits moving forward. So this was a big step for us to be able to get that. We worked very closely with CMS, looking at clinical criteria and, pulling up evidence and lots of back and forth on that. In January, we also had approval from our CMS partners on our infrastructure process. So that is how we're distributing the community capacity building funds, which we'll talk about later, as well as another technical thing related to DSHP. This is basically how we're getting the money to support this work. And all of those protocols were approved by CMS in January. So for those folks who are interested, we have more information on our website. I'm also happy to answer questions on that. Our contracting team has finished up the CCO amendment for both the Medicaid and non-Medicaid contracts for this benefit, and that was shared with CCOs, and our rules were filed. So January and February have been very busy, but we are on track and we're really excited about that. For anyone, if we go to the next slide, for anyone who is somewhat new to this, just a reminder that when we talk about health-related social needs, we are talking about the social and economic needs that impact an individual's ability to maintain health and well-being. These are things that are outside of a doctor's office that contribute to our health. And so in our waiver, we have focused on some specific supports related to housing, nutrition, climate, and outreach and engagement. We are fortunate to be getting a lot of funding from the federal government to support this work. There's $119 million that have been approved for the state to distribute related to capacity building funds. Those funds will go out through the CCOs to the providers. And so the providers in this case are anyone who's going to be actually providing housing supports, nutrition supports, climate supports, or outreach and engagement. We'll talk later about what it means to be a provider, but those funds are going to be dispersed starting pretty soon. And this is to help support our ability as a state to prepare to deliver these services. And then 900 million will be available for the actual services. So a reimbursement, just like in the healthcare world, when you go to the doctor and there is a payment that occurs, this will be the same thing, except this will be going to our community-based organizations who are supporting these new services. And just another picture of this, just to get a sense of that overall funding components. It's a little over $1 billion coming into the state over the next few years. Really exciting way to jumpstart this work and to create some better connections across our systems that serve the same people. An overview here of those supports. So this is a great slide for just a reference slide for folks. So the climate support are all related to devices. So these are things like air conditioners, air filtration devices, portable heaters, mini refrigeration units for medications, and portable power supplies during for operating medical devices during power outages. Housing focuses on members who are at risk of houselessness. And there's lots within that space, including rent, utility assistance, tenancy support, one-time moving costs, first and last month's rent, back rent, things like that, that really give us some options. Nutrition supports include such things as, prescriptions for fruit and vegetables, if you've heard of those, paying for medically tailored meals to support somebody's nutrition needs, as well as outreach and engagement. So this is really important for us, especially when we think about population-specific outreach and engagement or culturally and linguistically specific support that will allow us to connect to members who are eligible for these services. So if we go to the next slide, I'm going to do a deep dive, really deep dive into the climate supports so that if anyone on here is really about to deliver these supports, ready to go on this, that you have a true understanding of what this service is for the coming month. This launches in March 1st, so March 1st. And I do see that there are fast and furious chats, Jessica, so I will trust that you will interrupt me if we want to take a pause and answer them live. Okay.
I think right now they are things that are not directly on the topic we're on, so we'll circle back. We will circle back to you all.
Wonderful. Okay. So our climate services are launching March 1st, March of 2024. And as I stated, that these are very specific devices. So these are 5 devices that are eligible for providing to members. Air conditioners that support heat risks, air filtration devices to protect against wildfire smoke, mini fridges for temperature controlled medications, portable heaters for the winter, and portable power supplies for home medical equipment in the case of a power outage. So these are 5 devices that support this work. In order to qualify for these devices, I'm going to go through a couple layers of this. Someone has to be a current OHP member on the Oregon Health Plan, which is our Medicaid program, also be a member of an eligible population, and also have a clinical or social risk criteria that means that they need, for example, a portable power supply because they have a device that needs electricity, that type of thing. It's also important to note that one of the things that we will be carefully supporting ourselves through is that we have to make sure that this isn't a duplication of another state or federal provided device. And so that's something that we will be working with our partners with, and really want to be thoughtful about how and whether devices are provided. Sometimes someone may be eligible through multiple programs. And so it's important to make sure that this is not the one that we go to first. If you go to the next slide, this gives you a little bit more information about the eligible groups. And so these are groups that we've titled our transition populations. These are all people who are transitioning across systems, or they are transitioning in an age category or a stage of life that really puts them in a space where there's likely to be more instability in their care. And so we've really focused on this to not make it only based on a diagnosis, but to say we want to support someone during this time period. These populations are the same ones we'll see for nutrition and housing. These are our eligible populations for the waiver. So you'll see examples here of an adult or youth discharged in the past year from mental health or substance use disorder, an adult or youth released from the past year from incarceration, having been involved in the child welfare system. These are all things that can sometimes create some instability in the care coordination and the services that someone is eligible for as they cross systems or age in and out of different systems. If we go to the next slide, you'll see, again, we really want to focus on the fact that not all OHP members will automatically be eligible. Again, you have to be an OHP member, then you have to be in one of those transition populations. And then if you go to the next slide, we'll talk about this specific clinical or social need. So you'll see in that purple, this is the eligible groups that I spoke of. In the blue, there's a clinical need for the device. So it's not just that you are moving into dual status so that you're both Medicaid and Medicare coverage, or you're at risk of houselessness, but you also have a health condition that's worsened by heat, or you have a health condition worsened by cold. And so there are needs for a portable heater or an air conditioner. Thinking about like the smoke and air quality and what that may do for someone who has asthma, for example, or COPD. And so they really need an air filtration device in their home. Those are the clinical needs that we expect to see as a reference point. And then the last piece is a social need. And so they basically have to have be able to use the device safely and already haven't met their needs. They don't have an air conditioner in their home already. So those are the social needs for the device. So this is our eligibility framework. And then moving on to what that means for a member to actually go through this process. What we've been trying to support at the state, and which CCOs are certainly trying to support in their regions, is that we first need to make sure that everybody is aware of what these eligibility pathways are. So that's kind of where we are for number one. We are trying to support members in their knowledge as well, but it's important for providers to know this, or anyone who's interacting with members. Then there's a screening process. It's a relatively straightforward form that indicates that you think that you may be eligible. This can be done by the individual or through partnership with one of the providers. That would be sent over to the CCO or to the open card provider. And then there would be some verification and some validation of that to ensure that a decision is made. The next step there would be receiving the device. So again, kind of similar to any situation in a standard medical process of being able to get the referral and then approval, and then the device is provided, and then the individual would be able to use the service. This is, again, focused on climate. It's nice to have the climate benefit going first because we're talking about some very specific devices, but this will be the same model used for housing and nutrition when those launch later this year and next year. So If all of this is either a lot or you have just more specific questions, we did want to make sure we have lots of resources available, also resources that you can share. We have a web page that has a lot of this on it, but then we have these upcoming resources that will be shared. They're going through translation and plain language review right now that have to do with a 2-pager, an FAQ, as well as some of the details in the steps that I just shared about where are the specific templates and the referral forms and all of that. So we are working through that. We're going to have English and Spanish first. We are going as quickly as we can, and then we are moving to all of our expanded lists of languages as quickly as possible. The next slide just shows, again, benefit resources for members to be able to access. So checking with the CCO, certainly OHA and ODHS are in support and can respond to questions as well. And then open card members can reach out to their counties, and counties are also knowledgeable and supportive of this work.
I was wondering if now might be, because we're about to switch over to service provider requirements. Now might be a good time for me at least, to say out loud some of these questions. And if we have an answer, we'll go for it. And if we need to bring it back to a subject matter expert, that may be true of some of these. First off, at the very beginning, when we gave the dollar signs, the $900 million, was that for the 5 years of the waiver? Was that annually?
This is for the 5 years of the waiver. I will note, though, that our waiver started in October of 2022. So those dollars are continuing to be still eligible for expenditures within this timeframe through 2027.
Thank you.
Yeah.
I do see some questions about who is eligible for these funds, and I think we may want to point towards maybe a specific resource. I'm not sure.
Yeah.
We might have a later slide.
I don't think we have the slide in this one, but we'll make sure to share. It is pretty broad. It is anyone who would be providing these services. So we're talking about community-based organizations, but it can also be social service providers. It could be care coordination organizations. It could be outreach and engagement supporting specific populations. It can be your city, your county in some cases. Anyone who will be providing some of these services. And so again, it's climate, nutrition, housing, or outreach and engagement, which includes case management.
Thank you.
Yeah.
Let's see, 2 specific questions on the devices. One is, do heat pumps count?
Ooh, that's a good question. I may need to.
We may need to double check.
Yeah.
And then is there an expectation that as benefits end, or if the need for device ends, that someone has to return a device?
No.
And then I see some questions that I think we will answer later on when we talk more about the community capacity building funds. There was a question about what it means to be a duplicative state or federally funded program. I'm not sure if we have more details on what that means.
So I see that question. This is a little tricky, and we will be providing some more guidance. Your CCO can also help you. We don't want to be overly stringent so that individuals are at risk of not getting devices. But one of the requirements in Medicaid and CMS federally, nationally, is that technically it's supposed to be a payer of last resort, meaning you're supposed to go through and make sure that there are not other ways in which an individual could be eligible for services that they're getting through Medicaid first. So at the very least, as we're launching this program, we just want to make sure that someone isn't actually in the process of getting these devices through another mechanism. And we're going to, be wading through what that looks like. I think nutrition is a good example of, there's lots of nutrition overlaps in terms of populations, but there's like time periods where there may be a cutoff that the waiver could step in. And so we know that there's a lot to be braiding together here, and it will be challenging. So I hear you. We are working on providing better clarity on that. And also it may be a little bit muddy and we may need to just work through with individual organizations and CCOs in the beginning to navigate that.
And then I see a couple questions around eligible transition populations around, let's see, there's one about, does incarceration include individuals recently released from an immigration detention center?
Yes.
If someone remains in mental health care, are they ineligible for these services?
I'm not sure if that means, you're welcome to expand on this. If they are in a current residential facility, then they would not be getting access to the services, to my knowledge, in the facility, but as they are released, we would be supporting them through that. And if they're an outpatient, they would certainly be eligible.
And then I think because we have for the housing services, an initial focus in November of people at risk of houselessness, there was some question over houseless versus at risk, and if we can clarify for climate.
Yeah, super confusing. Apologize for that. Yes, currently homeless are eligible for these devices. I think in reality that is a little tricky because we also know that you know, we're not going to show up and provide an air conditioner to someone who is, you know, living in a tent right now. But there are ways in which that we can support someone. So some of the creative things we've explored would be like, are there specific coolers that could be, you know, available for someone to maintain their medication that would count as a refrigeration device? And so the challenges here is that our transition populations are the one I listed. And then for the specific benefits for climate, for housing, for nutrition, there are little pieces about how those are carved out for eligibility. So currently homeless are eligible when it makes sense for the climate benefits.
Thank you so much.
Yeah.
And I'm trying to skip over the ones that are about community capacity building funds because I know we have slides and we'll be talking more about those. I do see a question about when information about how people can request climate services will go live. And I think, let me poke around. I think a lot of these resources that are just about to be available will have a lot of good information there.
Yes, I think you're right. I know you're right.
Thank you. And I see, I think this comes up really often. And I'm sorry, I will get back on track in a second, but I do want to pull up our pyramid because I'm seeing people talk about the $904 million and the $119 million like they're interchangeable. And so I do just want to bring us back to this slide. There are the funds, the blue top of that pyramid is for those community capacity building funds, those sort of startup costs, the one-time investment. And then there's the provision of services themselves, which is that orange part. And I want to make it really clear that those are two differently allocated pots of money and that they have different rules and different expectations. And so I want to make it clear that when we talk about community capacity building funds, that's very different from that $900 million that forms the base of that pyramid. That will be the more ongoing over the 5 years provision of services reimbursement model funds. And now I will hand it back to Steph now that I have talked for longer than I meant to.
No, that's really helpful. Thanks, Jessica. Yeah, so that 119 million are for those startup grants, and then the services as they provide a service. So as there is somebody who is helping someone navigate, or as we are actually providing rent, that will come out of the 900 million. The payment for the air conditioner, that's out of the 900 million.
Thank you.
Yeah.
I will pop us back to where we should be in this presentation.
Great.
And
I do see there are some specific climate questions about costs and all of that. I'm going to see if someone can hop on and help answer some of those questions. We do have a fee schedule that shows like the amount that something can be reimbursed. They have some specific devices that are recommended based on You know, what we've seen at this in our state experiences so far that have to do with not just the cheapest, but duration, how long a device lasts, really wanting to get the most bang for our buck, and make sure that, you know, we're not providing folks with a device that then isn't helpful in 2 years. So we'll see. Let's see. And I did just get one quick question about heat pumps, and the response was that heat pumps are normally a reference to a larger heating and cooling unit for a larger home or building, and so would not apply to our HRSN portable devices unless someone was in an apartment building where there's already that structure in place that a heat pump could be used for that and just connected into an existing system.
Thank you.
Yes.
And I know perhaps just enough to be dangerous, but I know that there are warranties and additional supports that are being built in on the repairing and maintenance or replacement of climate devices. So that is built in. And I hope that answered that question.
I do see some others. Jessica, would you prefer that I continue, or should I try to answer some of these other questions that I see here?
I want to make sure we can cover all of the content. So I think also everything that's going into the chat, we are capturing, we are building materials to respond to them. And so even if we do not get to the answer today, know that your question or your thought is not being lost.
Yeah.
But I do think we should move forward, and we can circle back once we have gone through a little more of the content. Thank you.
Okay. That sounds great. And I will just say, I do see one here about the climate emergency. Previously stated there had to be a climate emergency declared. That is not the case anymore. This was a change that came about late last year based on conversations with the federal government. So there does not need to be an emergency declared. So this can be a preventive need. We can start getting devices out to individuals who may be at risk based on all the other eligibility that we said. So hopefully that helps us get devices out before an emergency, which is great. Okay. Great. So service providers. Let me get back to, okay. So our service providers, when we keep talking about who these providers are, what they're doing in the state, these are minimum qualifications to become an HRSN service provider. And so you have to be ready to serve eligible populations available for that. We want to see strong community relationships. Ideally, you are in place in a community already. You would demonstrate that you have the ability to provide culturally and linguistically responsive and trauma-informed service delivery. Would have any necessary and appropriate business licensing or accreditation, be able to receive referrals and report on service delivery status, be able to invoice for services. That can look lots of different ways. We are building towards an electronic system, and also know that some organizations will absolutely need to do this through paper initially. Demonstrate a history of responsible financial practice and comply with any reporting, oversight, and business registration requirements. And I'll just say for all of these, we also know not everyone's going to have these to start. That's what the capacity building funds will be for, is to support someone in becoming an eligible provider. Next slide. Specifically for climate, you need to be able to deliver the climate supports, and that can include installing device in a member's home or coordinating with a vendor for installation in a timely manner. If you are a vendor, that means that you don't actually need to meet a provider qualification. I know that's a little tricky and there's some nuance there. When we think about vendors, in some cases, this may be like a Home Depot that is delivering an air conditioner to someone's home and supporting installation. In that case, they do not need to, Home Depot is not going to be one of our HRSN service providers, but they can deliver the device for us. For the provider and vendor requirements, we also want to ensure that the installation can occur in a reasonable time frame, and that if for whatever reason, whoever is providing the device cannot install, then we would just need to make sure that the contractor will coordinate someone else to help install. And then Community Capacity Building Fund update. So again, these are our grants. We've had full webinars on this that we can point you to if you want more details on it. But just to give you a sense of where we're at right now, if you go to the next slide, this is our application and funding timeline. So we have already signed agreements with all the CCOs for them to be carrying out the Community Capacity Building Fund grant process. These dollars will go through the CCO as a pass-through. We are currently in February where that star is. So CCOs should be doing outreach to the eligible providers. We know that different CCOs are at different stages. Some of them have already done some initial capacity building themselves and have hired people to support this work. Others are leaning on their existing staffing right now. And so in some cases, this may be just launching. What we will expect very shortly is that the window opens on March 1st for applications for CBOs or other partners to be applying for these funds. There's an application that is standard across the state. There's a budget request that's pretty standard. There's very specific things that these funds can be used for related to capacity building. So that window is through all of March, all of April, and all of May for applications. So there's lots of time for an organization to become more familiar with what the needs are. This is for climate, housing, and nutrition. So any of those providers and outreach and engagement. And then beginning in May, there will be a review of those applications by CCOs. CCOs are going to get kind of double checked by OHA in this process to ensure that they are, building an adequate network and that there's been adequate outreach to other and new providers, really supporting our broad communities. And then there's going to be a couple of different rounds of funding later this year in 2 batches. And we anticipate that providers will begin using the actual funds starting in September. This will also have additional funds in 2025. We know that not all providers will be ready to go this year or may just not be interested this year, but we will continue to have these funds dispersed over the coming years. This probably should have had this slide first, I'm realizing, but these capacity building funds, again, are really supporting providers and organizations that will help with these new Medicaid services. They will be administered in 2024 and 2025, and we will be required to be reporting on specific elements of the funds and how they're being used. Next slide just shows, again, another way of looking at this timeline. Same information for the most part, but just wanted to make sure that you're all seeing some of the communications around this. The windows will be opening March 1st, so you'll see local CCO information about this, as well as some state information to support that. There is going to be a public awardee data bank that we'll have on our website when awards are announced, that we'll be building to make sure that members and other providers are aware of who has received these funds and who is going to be a provider in this work. We will be announcing in July and September the first round, and then we'll continue to be advertising more funding opportunities as time goes on. The next slide just shows our website for this work. Sorry that it is not more friendly for remembering, but it is clickable, and we can probably drop that in the chat as well. The resources on this web page are lengthy, really also have resources that can be just taken and used in your community. So summary, some flyers, things like that, that could be used to support this work. And so with that, I think we're going to pause and go to Q&A.
Thank you so, Steph. Oh, thank you so, Steph. I was going to say thank you so much, Steph. Goodness, there is so much good stuff in here. Let's see, things that are specific to the community capacity building funds. How about activities that happened in advance of September 24? Can those be billed retroactively or for reimbursement was the...
That is a great question. I will see if we can find that out. Or I'm guessing, is Lisa on? Don't think so. Let me see. Anything else, Jessica? What else?
Yes. Can the community capacity building funds fund staff?
So there are specific aspects of the funds that can be used for hiring purposes, training purposes, recruitment purposes, maybe, you know, one-time bonus to hire, that type of thing. But the vision here and the way that CMS has really encouraged us to think about it is that these funds are to get us up and ready and prepared, and then the services themselves will help with some of that ongoing stability and cost and that sustainability, because as soon as you start providing the services, you'll be reimbursed for those services. And that's the vision on how this builds towards sustainability from the Medicaid side.
And then I see a few different questions around submitting grant proposals. Should organizations submit in different categories? Can they submit to different CCOs?
They can submit to different CCOs. On the application, it'll show, you know, we put this out for if you have overlapping CCOs, for example. We also have a set aside for tribal organizations and tribal governments. And so you can apply to multiple, and it just asks who else you've applied to so that we can understand if it's the same application to all three, or if you've, you know, targeted this to say for these members of this CCO, we're asking for, you know, hiring support. And for this CCO, we're really targeting our need around IT support, for example.
And I do also want to clarify with that by going through a CCO for this grant does not mean that you can only serve members of that CCO. So while I feel like I'm going to try to channel my inner Lisa here, and I hope I get it right, but I think you can put in multiple applications across CCOs as long as they're not duplicative. So that doesn't necessarily need to align with the exact CCO population you're seeking to serve. I do see some questions around OHA oversight and guidance around these grants for grant limits and then decisions.
So let's see. Has OHA provided guidance to CCO regarding grant limits or ranges? Lisa said she was going to hop on, so I'm going to ask her. As soon as she's on to answer some of the more specific questions about some of that. Let's see.
While we're waiting for that, I do see some questions or comments around learning more about the process of becoming an HRSN provider. And that's very important to understanding what kind of funds you may need or how you would need to leverage these different opportunities. And so I did want to call out on the 27th, I think is that a week from today, we are doing a week from yesterday. We are doing a more detailed technical assistance session that really focuses on provider enrollment and talks about billing as well. I don't think we get into reporting on the 27th, but other aspects of this that will be very useful will be shared. We will be recording it, and I will make sure, I believe the technical assistance session is already on the Community Capacity Building Fund's website, but I'll make sure to get that to you all as well, because absolutely, it is really important to understand what we are asking of you before you can figure out what is needed for your organization to be able to provide that. So I did want to do that call out. And Lisa, I believe, has joined.
Yes. So Lisa, we have a few questions for you and the CCBF questions. So I think the first one was related to any retroactive payments for activities someone may have in July or August. Would you want to speak to that?
Yeah, they cannot be used retroactively. So it needs to be any kind of activity or planning that you are planning for ahead of the time period that we can award the funds.
Okay, great. And has OHA provided any guidance to CCOs related to grant limits or ranges, or?
It's going to be different for every CCO. They all have a different amount of funding available to them based on their membership, with some slight adjustments for urban and rural settings, service areas. So they also may have different areas where they really need to develop their network. So some may have a need to really pull in maybe new housing providers, but have a pretty good network of I'm just totally making this up, but they really need to determine kind of what the needs are in their service area. And we know we have a vast difference across our state for those kind of networks and needs and gaps. And so they really need to analyze their HRS and potential provider network and really prioritize where their gaps are, where they may need to bring in or really prioritize maybe a culturally or linguistically specific type of organization. So there's flexibility for them to do that. So I'm sure our CCBF website was shared, but there are, some resources on what are the different areas that these funds can support. We have frequent, but there's also a direct email, happy to answer really specific or tailored questions. I would encourage anyone that's looking to apply to reach out to this and also provide some information that's really specific to the network that they need. Through our website, this is really helpful. So each CCO has a website and a direct email address for you all to contact so that you can have those types of conversations. Thanks, with Lisa.
them. Do you have any guidance about organizations that may be in
Yeah, I have been telling organizations that, again, I would really encourage them to reach out to those CCOs to understand, does that CCO feel like they're really going to prioritize the IT, in their area? And so they're really looking for applications that are emphasize that. So you could, apply to one CCO and emphasize that in your application, apply to the other CCO and maybe emphasize what they're really focusing on. So I would really encourage you to have those conversations with the CCOs and even connect together to really work with them on what would be the best way to build that application. They are also asking us in terms of like, how can we create some visibility into, which organizations are applying to multiple CCOs. You will see on the application itself that there is a space required for an organization to indicate if they are applying to more than one CCO. But I would really encourage you to be proactive so that you can really have those conversations to develop an application that is really going to be most successful with each CCO, because again, they do have the flexibility to kind of prioritize different areas that they feel like really need support in their HRSN provider network development.
Great. Let's see.
Yeah. Do you want me to respond to that question?
Sure.
So
yeah.
In the chat, and there's some more. I'm just looking at the last comment. So if I've missed others, please let me know. But the comment in the chat says it would be helpful for OHA to provide direction to the CCOs that they establish grant ranges or limits. Some of the CCOs have been vague regarding grant limits or ranges. which will make it very difficult for CBOs to figure out how to prepare grant applications. That's really helpful feedback. We can certainly encourage them to do that. We are meeting with CCOs every week to help them in this process. And so I'm happy to bring that feedback back. Because each CCO has a different amount of funding available to them, we didn't create strict guidelines. We also, have allowed flexibility for organizations to request multiple years of funding. And so again, I think it would be ideal for an organization to reach out and try to get input from a CCO. I will say that I think it's completely, it's great feedback to ask that they start putting some of that standard, like, here's our priorities, we're looking to fund grants within certain ranges on their web pages. That might help standardize the amount of requests for information that they receive. So that's really helpful. Thank you. So the next one I see is, okay, I will work with a tribal community and most individuals choose to remain on an open card. Are these resources available for fee-for-service members or only through a CCO? That's a great question. We actually are doing a CCBF tribal set-aside. And so tribes will have CCBF funds, but we are also requiring that these funds be available for fee-for-service organizations. Aside from kind of like the tribal set aside, we have not really uncovered a lot of organizations that are just fee-for-service, that are only serving a fee-for-service population and wouldn't have a CCO, like serving CCO members as well. So, if you are aware of organizations that would kind of be in that window that we may not have on our radar, then certainly appreciate hearing more about that.
I do want to interrupt briefly because I see a hand is up. Mercy.
Hi, good morning. I was wondering why it is encouraged for us to apply at more than one CCO. Do you know what would that be?
That's a great question. And I think I understood the question to be if an organization wanted to apply for more than one CCO, you certainly don't need to apply to more than one CCO. There are organizations that are statewide. So we've been fielding a lot of questions for like a statewide organization, which CCO should they apply to, and trying to assist organizations in that process. But if your organization is really in an area where there's really only one CCO in that service area, then you would really want to just apply to that one. We're looking for the most efficient process for you. So if I misinterpreted that question, I apologize. If, it really is based on the geographical area that an organization is providing services for.
Yeah, so to add to my question, I'm looking at all CCOs here, but then is there anywhere where it's specifically state which CCOs are nationwide or statewide? Let's say statewide. Because it will be important, you guys already made up your mind, but what need to happen, but I don't think this should be a very difficult stuff to be applied to more than 2, 3 CCO. So we just like the one that is statewide. So
there is not, that's a great question. There is not one CCO that is statewide. So thank you for pulling this up. So that's this, and then the CCO is color coded for the counties that CCO serves. And I absolutely wish this was easier, but this is kind of the process by which these funds are being dispersed. So if your organization was in Eastern Oregon and really only serving Eastern Oregon members, then you would really want to just apply to Eastern Oregon Coordinated Care. Is that helpful?
Very much helpful. Thank you so much.
Okay.
Lisa, I'm wondering if you can ask a question. It sounds like maybe the fact that CCOs have a range of dollars to them and that they aren't putting limits on the CBOs either feels a little open-ended. Would you recommend that CBOs put in what you think you need to serve this patient and we'll see what CCOs give to you? Or do you think that they should be having that conversation with the CCO first? How should they navigate that?
I really appreciate the feedback. I will say I think it is a request that I want to send to CCOs just to help publicize a range or, potentially, and truly CCOs may not have enough information to feel like they can post a range. They may not know what kind of application ranges they're going to get. I do think you should build an application based on what your organization needs. And that should be the foundation for the request, as much as you can connect with the CCO to understand kind of what specifically they're going to prioritize or what they feel like are their critical needs in their network development. I think that would really help inform the application process. I know there are quite a few CCOs that are holding information sessions. And we've been trying to collect those to push those out. And I definitely want to follow up with this group with that information so I can be responsible for finding that and sharing that back out.
Right. The technical assistance training on the 27th will, I'm sure, be recorded so that others can view it, and we'll be sure to post that as well. And I do just I know we're just about at time. I see that Jessie Wilson has joined us. She's our operations director for the waiver. And we did have a few questions on the climate devices that I just wanted to see if we could get to quickly. So Jessie, I don't know if you can speak to one of the questions was about benefits covering staff time to assess for or deliver services for the climate devices. Did you want to speak to what is being covered?
Yeah, so I guess I would want some clarity on the term assess, but for providers or individuals who are contracted to deliver and help install the device, there would be that the benefit does cover that, air conditioners.
Okay. Which probably makes sense, right? The rest of them would be plug and go, right?
Mm-hmm.
Right. And I think that was the second question I had was around CCOs, and if they don't maintain vendor requirements, how would a member be supported in complaints? I think this.
I think that members should feel free to contact their CCO or their open card members, contact OHP's fee for service program if there are issues with devices. In terms of support, I think there was another question in there I'll just kind of loop in around maintenance. CCOs and OHA's fee for service program will support members with device issues or maintenance as long as they're in that warranty process. So 12 months from the date at which the member received the device, that 12 months, there will be some maintenance covered that the CCO can provide, as well as OHA's fee for service program. So for issues outside of that period, I would still encourage members to reach out to their CCOs and the fee for or the open card provider to help resolve issues.
Great. We had a question about whether or not clients are responsible for repair and maintenance of devices.
For repair and maintenance?
Repair and maintenance.
Yep. So the CCO or OHA's open card provider shall support members with service call coordination or device replacement repair within that 12 months period from when the member received the device. And devices usually have longer warranty periods. So if there are issues, I would just encourage members to continue to reach out. But definitely for the first 12 months, that maintenance and repair will be covered by the CCO or the open card provider.
Great.
Does that answer the question? Okay.
Yep. I had a question. It looks like general understanding, what's your best guess about the time frame for someone who applies and when they might receive a service?
So I can say that it might vary a bit, but from the time that the CCO or the OHA fee-for-service open card provider has all the information they need to determine eligibility, it should be 14 days. So they have 14 days to notify the member of whether they've been authorized or denied the device. And then once they've been authorized, the member should expect the device within 30 days. If there are issues that would extend the time frame beyond that, then we have some contingency planning that OHA can support. But 14 days from the time the eligibility information needed is acquired.
And I think, I know that this comment, I know we're at time, so this one was specific to some of our housing needs as well. And we'll continue to have those conversations about, eviction notices and those timeframes. So the last one was around the tribal community needs for Columbia River. And I think we'd love to follow up with you on that need. If you want to reach out, that would be great. And we have that website, right, or that email address right there that you can ask about that. So thank you so much to everybody. Jessica, I probably turn it back to you to say goodbye, but thank you. Really appreciate all the questions. Hopefully this was helpful.
I know we're over time, so I'll be quick. We really appreciate you all, and I really appreciate our subject matter experts and Steph, all of you. I mean, you are both a presenter and a subject matter expert, and thank you for being here today. And we all look forward to seeing you next month and or at any of the other engagement opportunities that you may be participating in. Thanks so much, Trevor. I think we can